Hi, this is Dr. Steve Vargo with IDOC, and the question of the week is how do I deal with slow employees? This question comes up probably a little bit more these days in a or as we return to practice after kind of this post-quarantine environment where efficiencies become a bigger issue. And a lot of offices are asking about employees who are operating a bit more slower maybe than the owners or managers would prefer. So there's two things that I'll typically talk about or suggest in these scenarios. And one is eliminating the confusion and really getting clear on the time aspects of this, and maybe eliminating these more arbitrary terms like fast or slow, which mean different things to different people, and really getting clear on what the expectations are. How long on average should it take to sell a pair of glasses? How long on average should it take to pre-test a patient? Knowing that there's going to be, it's not always going to be perfect, but how do we get clear with the employees in terms of more concrete timeframes that it should take for them to perform these different tasks, and eliminates that confusion. The other one is just to observe them and give feedback on things that they could do to do their job more efficiently. So in this role, whether you're an owner, whether you're a manager, you take on more of a supportive role in terms of I'm going to help you get to that point, because they may still not know. They may say, well, I don't know how to do that in 10 minutes or 15 minutes. So your role becomes observing them and giving them feedback. When I was in practice, we had an employee once who was a technician, and we loved her. She was great. She was great with the patients and the other staff members, but she was so slow in the pre-testing room that we finally had to have a discussion with her. And as it turned out, she said she liked to talk to people in the beginning to get to know them better, and she thought that was good for service. And she was absolutely right, 100% right. But she wasn't looking at the bigger picture in terms of the patient behind that patient we were having more people start to get upset about the longer wait time. So in that case, all we really had to do was have a talk with her, and she had to work and talk, or talk and work at the same time. And it was as simple as that. Other employees, it may be an issue where they need more training to do their job better. Maybe there's aspects of what they need to do that are taking too long because they're not sure how to do it. So just try those things and see if that will help your office as a whole operate more efficiently, and maybe a few ways to deal with some of the employees that aren't working quite as quick as you'd like them to.